Hi, welcome to the show. We have a very dynamic personality today, Dr. Shreyas Naik. He is a very well-known name in and around Goa Medical College as well as Goa Dental College. He has completed his BDS and MDS in OMFS or Max Specs from GDC itself. And he has been a lecturer. He has been on visiting consultations in and around hospitals in Goa. So I welcome Dr. Shreyas Naik.
Thank you. Thank you for having me on your show.
So today's show is going to be very important. The podcast will involve a lot about dentistry, about post-graduation or the specialization. And I think for students or dentists who are looking to do post-graduation in dentistry, the various fields, Dr. Shreyas is very well decorated when it comes to all that qualifications, specialization, and also fellowships. So I think it is going to be a very enlightening session. Now, Shreyas, we'll start from beginning. Like, tell me about where were you brought up and how was your schooling, and tell me about your family environment as growing up.
I was born in Panjim and brought up in Panjim in a house of two doctors. Father is an ophthalmologist. He's worked in GMC throughout his career until retiring as the dean a few years ago. Now he has his own private practice. My mother has done an MD in PSM and she's also worked with DHS throughout her career. Now she's retired as well. I have a sister. She's an engineer. She's the different one.
Yeah.
She lives in Pune now. But growing up, our dinner time conversations were not very interesting. It was always about medicine and the cases that they used to deal with. But so that influence was always there. As a kid, I was not very studious. I used to be mainly found on playgrounds around my neighborhood, playing with the neighborhood kids. Always having tanned skin and skin knees.
Especially in summer vacations.
Especially in summer vacations. Whenever I was not playing, I must have been at home reading books. Music was always a keen interest, so I used to spend hours on my computer discovering different genres of music.
Okay.
Coming to schooling, my primary school I changed a couple of times. And the real defining moment came when I joined secondary school in People's High School in Mara, Panjin. It was a beautifully located school in the bylanes of Fontainebleau.
Okay.
We had really good teachers who sparked an interest in my core subjects, I would like to say, such as science, maths, and English. Some of the best friends I have today were made in People's High School. They still comprise a vast majority of my friend circle today.
And you're still friends with them?
Yeah, it's just like school days. Nothing has changed. Like, all of us are in different professions now. But when we meet, it's like we're back in time.
The real ones. This is a bit interesting that Shreyas comes from a family of doctors and one engineer. So how was it like? Why dentistry? Like, how did you come, to that conclusion? I think when there is a common conception that when you come from a doctor family, your family want you to be a doctor, and going to dentistry, how did you come to that conclusion?
Frankly speaking, out of all the dentists in the world today, maybe very few must have chosen dentistry. Rather, I would like to say dentistry chooses you. Everybody sets out, I want to become a doctor, I want to get into MBBS. And then for whatever reason, you don't make the cutoff. You miss by a few ranks here and there. Dentistry presents itself.
Yeah.
A few people who are interested in it stay. Few people try to attempt again and go for medicine in the next round. So for me, it was similar. Growing up, I never remember wanting to be a doctor. I was more interested in sports and numbers. So this is interesting. As a kid, at one point, I was very serious when I, used to tell people I'm going to become a cricket statistician.
Okay.
And I, at times, actually explored that possibility as a career. But later, as biology subject came into my life in, say, 9th, 10th, 11th, that's when I started getting really interested, and I realized that a surgical field would be right for me. Father's influence was always there. He being an ophthalmic surgeon, I've seen how he made difference to people's lives. I knew that I wanted to be a surgeon. When we had GSET that time, I did very well in biology and chemistry. But in physics, I don't know what happened.
Fumble,
Some sort of a fumble. And
we all do in physics.
So
that was your first attempt?
Yeah, I've done only one attempt.
Okay.
Physics paper through some curveballs, and that brought I missed the cutoff by, I remember it was 5 ranks. And at that point, it really felt like, wow, this is the end of the world. I'm not going to be a doctor. And then suddenly, this is a Harry Potter reference, when you run towards platform 9 3/4 and it's a wall and you think you're going to bang in the wall, but you suddenly pass through something magical and a whole different world presents itself.
Yeah.
That's how JDC was for me. I'm like, this is a separate college.
Yeah.
I always thought this was a department in JNC.
GNC.
But turns out it was a whole different world. Dentistry is a vast subject. There are 9 specialties in dentistry. Coming from a medical background, one would think I know that, but awareness is not that much, even within doctor community. When I realized, this is what dentistry is, and it has this specialization called Oral and Maxillofacial Surgery, I decided to stay and see where it leads.
So how many years it takes to become a dentist?
So
I mean, it's a BDS degree.
BDS is a 4-year course with 1 year of internship. So that's 5 years. The first 2 years are common with the MBBS batches where the lectures are in the same room. We also have, the
Civil subjects.
Yeah, dentistry deals with teeth, but at the end of the day, teeth are lodged in the human body.
Yeah.
So you have to learn the same basics, anatomy, physiology, biochemistry, even the second year subjects. Right till third year, we have medicine and surgery. But there's a difference. In the first year, along with the medical subjects, you also have subjects like dental materials. You have something called oral anatomy and oral histology. It has a different aspect of practicals to it. So instead of just lectures, we are also exposed to all the materials that are used in dentistry. Very early, we learn how to mix them and manipulate them.
So more of a practical experience is given very early.
Yes.
As you were saying that a lot of practical experience was given to you very early, and also like initial subjects are compared to MBBS, it's almost same. So what exactly separates BDS from MBBS? What is the difference for our general audience to know? Just give us an idea.
One major difference is the practical aspect of it. Dentistry is a science, but it is also very much an art. So your hands have to learn how to handle different materials. A lot of time we spend in the lab. We are taught how to make dentures, and we actually sit and make them. Later, now as an established dentist, people send it to a lab, but as a student, you have to learn how to do it all on your own.
Since you took BDS, lot of students who take BDS, and this is a practical part, they face a lot of stigma when it comes to BBS and BDS. I have heard a lot of students facing the stigma as like BDS is taken by people who don't get MBBS, or you didn't get MBBS, that's why you took BDS. And that is one of the most important, or the saddest part here. That kind of stigma faced by young dentists who want to join, and I think some might not join because of that. So what are your thoughts on that?
That statement where dentistry is taken by people who don't get MBBS is not entirely untrue. Like I said,
Yeah.
Very few people choose dentistry. Dentistry chooses them rather. But having said that, I myself had quite a few classmates who had left medicine state and come for dentistry, because I guess they must have been aware about what the subject is.
Yeah.
Most people are not. As a BDS student in first year, when you attend common lectures with a BBS student, there's that little bit of pulling that keeps happening. And at that point, it triggers you, like, you're not a real doctor. And the fact that some famous movie probably created a meme that these are not real doctors, that also didn't help. But as you mature, you realize, dentistry is a whole different skill. And it very much is medical. It's not carpentry. You are in the end working on a real human being. You are dealing with medical conditions. It is very much like the oral health is a reflection of overall health. Yeah. So you are detecting cases early, and it is a responsibility. So whoever says you're not a doctor, I guess it's their ignorance.
That's true. I think that ego battle and all that, it is more when people are just doing BDS or MBBS. As they grow, as they do specialization, as they see more and more patients, clinical experience, they have that holistic approach with dental as well as, exactly. That will come in the head session. But that is the time I think people learn to respect each other, that every part focuses on, welfare of the patient. Initially, we might not understand it, but as you gain experience, I think that is the part we understand, that how important both the fields are. So that part you have to remember. Initially, you might feel some stigma, but later, as you mature, you're going to get that respect that you deserve. I also heard about that lot of toxicity being there. Now we are coming to the the dental college itself. There are a lot of toxicity in the departments or while doing dentistry, all about deadlines and all that. They have to meet up. So how was your dentistry? I mean, how was your BDS journey? And like, was there any toxicity you faced?
My journey was not your run of the mills, straight linear journey. I had a few setbacks early on. When I joined BDS initially, it wasn't exactly what I imagined it to be. It was a very rough transition from 12 to college life. One would expect college life to be, a lot more freedom, and you would be a liberated person, ready to wear casuals to, and then suddenly you cannot wear jeans. Have to come clean shaven and things like that. Yes, they were at that age, you don't realize it. They were grooming you to be a professional. But as a 17, 18-year-old, you have that rebellious streak in you, and then there is friction. So toxicity is an extreme word, but yeah, there were incidents where one felt a little bullied and harassed. At that point, it tends to weigh you down as you're a newcomer, but with experience, you'll learn how to react better to such situations.
That toxicity is there.
I guess in every walk of life, toxicity will be there. It's just how you react to it and manage yourself better.
But did it affect you anytime, or you always took it in a positive?
Like I mentioned, when I joined BDS, I was not really interested in all the dentistry subjects. Very early on, I knew that if I am to be in dentistry, I have to do oral and maxillofacial surgery. But I had to complete BDS to get there. I was not, studying all that much at that point. I found the subjects very dry and boring. So I ended up not performing very well in my first year academically. Got something called a back, and I was put in a casual batch. Now, it's a horrible term if you ask me. Casual batch probably comes from you're in a casualty of a academic mishap. So then you are stigmatized. You're treated like a stat child.
Backward class.
In a way.
When it comes to education.
Yeah.
Or not smart.
Not smart. So nobody gives you a chance. It's like, what will help by teaching you? You are anyway,
you don't study. Yeah.
But I guess when you experience rock bottom, that's when you can bounce back the hardest.
Yeah.
Till then in my life, I had never experienced any failure. I was always on top of the class, getting good marks by studying last minute. At that point, it taught me a lot about myself and about how people,
change.
People change, because it is said that success has many fathers, but failure is an orphan.
Yeah.
I experienced all that. Later, it was difficult. It was a tough 6 months. I cleared eventually. And as we progress through BDS, when you enter third year, you get into clinics. And third year student starts doing procedures right away under supervision.
Okay.
It's not that you wait till you finish your BDS and you enter clinics. So as the clinical exposure came into the picture, all the subjects that we used to study started making more sense. I started developing a greater interest. Finally, I was in that oral and maxillofacial surgery department as well.
Okay.
So as you reach closer to the end of the tunnel, you start gathering that momentum. My performance is improved. The second half was definitely better than the first half of my BDS.
I think that back part always hits, like especially when you've never experienced that kind of thing earlier. Label of casual thing that actually I don't think it should be kept, or it should be maybe.
Yeah, I mean, we can treat everybody with kindness, and you don't have to write anybody off.
I think everybody who joins medical field in a way is smart up to a certain extent. It just matters that some tend to study little bit more than the others, and it also depends on time. Like certain people are not mentally on, emotionally or mentally on the same level as the others. Maybe they take some time, but they eventually get there.
What every student needs is one teacher who will spark that self-belief in them.
Yeah.
Eventually, after I finished my internship, it came to that time where, I had to think of PG, because I was always focused on that. At that point, admission system was such that there were 50% of these PG seats were reserved for state quota, and the remaining 50% was for all India quota. The state quota was calculated not on any entrance exam, but on your performance from first year to final year. So cumulative score was taken.
Okay.
Now, with the kind of performances I had in my first year, even though I did well in the second half, it brought the average down, and I did not stand a chance there. And I realized that if I have to be an oral and maxillofacial surgeon, I have to take that all India route. So I went to this place called Davangere in Karnataka, and I met my mentor, one of the most important people in my life, who's started the transformation. His name is Dr. Eisen Thomas. I went to meet him once before I joined, and we just had a 5-minute conversation, and it was enough for him to judge. And he said, Shreyas, forget all that happened so far. I can tell you that you are meant to get that All India rank. just that was enough for me. It just sparked something. I just left everything in Goa, set base in Davangere. I was there from March 2015. The day after my internship, I packed and left for Davangere. And for our exam got preponed that time, so eventually I ended up being there for 9 months. December was the exam. We studied night and day. It was a transformative experience in such that I realized how much I had not read during my BDS, because this time we covered subjects in depth. He used to keep giving us tests, and the performances and ranks in those tests used to spark further motivation in me. Like, oh, I can do well. In a class of 500 people, I'm coming in top 5. So I guess I can do it.
I mean, we definitely need a certain person to, give us that motivation or to ignite the spark, as you said.
Other than the person, the environment that he created there, it was a very positive environment. Everybody was competing against each other, but everybody was also helping each other. It was never a cutthroat environment where I'm not going to tell you where to read this from. Everybody just reached out for each other.
Yeah.
And it was a great 9 months in retrospect. At that point, of course, it felt like, I'm studying and sacrificing all the fun that is back home. But you have to do that if you have to achieve something.
That was your only attempt for the
Yeah. So since I had no plan B, I didn't want to spend another year in Davangere. I realized that this is my do or die moment, and with no plan B, I gave it my all. Luckily, it all fell in place, and I got the rank in my first attempt.
It was around 120.
It was 125.
25.
So just for perspective, that at that point, the exam was called AIPG. It was answered by around 25 to 30,000 people, and there were only 200 seats for government colleges.
Okay.
After that, there are private colleges, but since government colleges offer that extra advantage of having a larger patient base, and of course they pay a stipend as well, lesser fees. My target was to get into a government college. 125 was a good rank. It gave me a choice to get admission in any college that I wanted.
It's a very impressive rank. 125 is a very impressive rank out of like 25 to 30,000 people who give it. Very impressive. Now, a lot of people, prepare for this exam, which is, I think it is changed now. Is it?
Yeah, now it's called NEET. The format is slightly changed, but I guess how you prepare for it would more or less remain the same.
Okay. But there are a lot of people who are, preparing for this exam. So any kind of tips you want to give to these people? What was your thought process around that, time? Like you said, you had to take few months and work, like study night and day. A lot other people or other dentists who might be in the same mental space. So what advice you want to give to them?
Over the years, I have interacted with several intern batches who were preparing for their exam, and have guided them. Just say what I've been telling them. You have to have your basics strong. The foundation of all the subjects is strong. You can answer most of the questions, because these questions are multiple choice questions. So they test your concepts and your understanding. You can't mug up for these exams. And other than your preparation, it's also how calm you are while answering the exam, because it's a race against time. You have a lot of questions. You have very limited time. So there are certain ways you have to approach this. You have to answer it in rounds. If you're confused between two options, you sometimes have to take your chances to maximize those, because it is +4 and -1 if I'm not wrong. +4 for every correct and -1 for every wrong answer. And
negative marking.
Negative marking. So if you just leave, I'm confused and I'm not going to answer, you'll not be in the race. It's the top rankers are just different from the ones who don't make it by that one answer maybe.
Yeah.
That you took a 50% chance on and got it right. And of course, when I say chance, you can't just blindly mark anything, because
it's not the earlier G-side wala.
3-4 wrong questions can also take you out of the race. So it's the preparation aspect of it, and then it's how you answer the papers. That's why it's very important to answer a lot of mock exams regularly, not just sit with shin banks and go through the questions. You have to test yourself and see that you got the process of answering that exam figured out.
I think there must be a lot of mental pressure during that time. During that gap, especially, and even small things feel like a huge burden. Even the family, having a lot of expectations from you, the friends who move on, and all that aspect. So how do you handle that?
Absolutely. So this is like I would say a test match where you are in for the long haul. It's not a T20 where you answer and get out. You have to stick in and keep on consistently studying every day. But to put in the hours, put in the effort, and sacrifices are part and parcel of the whole process. When you take a decision to take 1 year off just to study, that adds a bit of pressure, because now people back home have expectations, and coaching classes have fees, and plus you're not earning. You just finished a degree and you're not earning. So there is a bit of pressure, but if you let that pressure weigh you down, it's going to affect your performance. So the best strategy would be to just try to control your mind, to separate all these pressures out and focus on what is your end goal. Just take care of the simple steps of the process. Now, if you look at a mountain and see how high I climb such a big mountain, you're going to get, weighed down.
Yeah.
Instead, just focus on, okay, I have to take this step and I have to take that step. And step by step, you will keep going. You will eventually get the summit.
Yeah. So it is more about seeing the immediate picture instead of the whole mountain.
Instead of trying to do too much in one day, you have to do little every day consistent.
Yeah, I think anybody will get overwhelmed if they see whole picture at once, because it is too much.
This applies to every field of life. If I know that you are into fitness.
Yeah.
With fitness, it's about consistency. It's about showing up every day to the region. Same goes with preparation.
Definitely.
For an exam.
Yes. We'll talk about the OMFS also, but I wanted to ask one more question about your UG days. Where were you hostelite or you were going home that time?
So I stay in Miramar, which is just 10 minutes away from Bamboo. So I did not stay in the hostel during my UG. During PG, of course, later we had to, because of the night duties and everything. But UG, I used to come and go every day.
Miramar, so it must be always close to beach, tourist.
I've almost grown up on the Miramar beach. Every evening I used to go for playing on the beach and come back with a lot of sand on my...
Yeah, and I think that is the first beach, even tourists who come, they, go to that beach. Coming to one of the most important part of this podcast, and I think this might be your favorite topic to talk also, because a lot of people don't know about all this, that, dentistry has all this specialization. Why did you choose OMFS, that is Oral and Maxillofacial Surgery? We'll call it as MaxFax. I hope I pronounce it right.
MaxFax is right.
Yeah, we'll pronounce
it easy.
Yeah, MaxFax, we'll pronounce it. So that is OMFS, okay? So why did you choose MaxFax? What other branches are there?
My case is a little different. I was very early on sure of wanting to do maxillofacial surgery as a specialization. There are, however, 8 other branches other than OMFS. So let me go in order. The first branch is oral medicine and radiology, where you deal with diagnosis of all dental and oral conditions, and radiology, where you take x-rays of the face neck region, which aids in diagnosis. Then there is pediatric dentistry, which deals with dentistry in children less than 12 years of age and developing dentition. There's orthodontics. That's a department that deals with braces and movement of teeth to correct malaligned teeth. There is periodontics, which deals with health of gums. There is conservative dentistry and endodontics, which deals with restorative dentistry and root canal treatments of teeth. There is prosthodontics, which deals with prosthetic element of dentistry, where they deal in making crowns and bridges in dentures and dental implants. There is a subject called public health dentistry.
Okay.
So that subject deals with the public health aspects of dentistry.
There are lots more to it.
And there is one more subject called oral pathology.
Okay.
So they deal with the pathology aspects of it, do histopath analysis. And
there are a lot of branches. I have never, till now, I didn't hear about any of these branches. Maybe OMFS I have heard. Orthodontics, you said that also I have heard. But other branches, these are like 7-8 branches, huh?
9 branches.
9 branches. You guys knew? I don't think this, any of us knew. But yeah.
Now implantology by itself is becoming it's a different branch by itself. A few colleges have a different department of implantology. I guess it will become a norm in a few years.
What are the most preferred branches or most sought branches in post-graduation?
Usually, the clinical branches are chosen first by the top-ranking students. Yeah. And amongst those, the ones which have more application in day-to-day dentistry, such as the endodontics or orthodontics, those are the sought-after branches. Now, implantology is becoming big as implants are getting popular. There are 3 branches that deal with implantology, one being prosthodontics, oral surgery, and periodontics. So these 3 branches have also got a lot of traction now because of implantology. OMFS always has its own glamour, and people want to become oral surgeon because it is associated more with medicine than with dentistry. So yeah, OMFS has always been a sought after branch.
Yeah.
OMFS, however, is not easy. It comes with a lot of work. You have to study the medical subjects, you have to do night duties. So
we'll come to that. I just wanted to ask, when you are doing PG, give us the idea, like how was your daily schedule, or what are the things you had to do during your PG in MaxFax?
So OMFS is quite different from other branches of dentistry as far as PG is concerned, because your hours are much longer. It's not a 9 to 5. We have 24-hour duties in the casualty. We have our full-fledged ward where we used to have patients admitted. So we had to start very early at 7:30 to go and take care of those admitted patients, prepare them for OTs. There were 2 days of OT given to us, pre-operative patients, post-operative patients, a lot of work. Also, casualty duties. As a fresh PG, we were put on alternate duties. So at any given point of time, you were either on duty or post duty. And that went on for 3 months. At the end of those 3 months, my batchmate and I were like zombies sitting in Nescafe, just gulping down coffees.
The post-graduation MaxFax, they have to be in casualty a lot. I think I also had seen Shreyas during his casualty posting. He used to be always with lab coats, and I think you carry some instruments or something. Or
so the cases that we get called for in casualty mostly are trauma cases, and we sometimes, when dealing with fracture cases, have to wire the jaws. So we used to carry those kits with wires and,
Yeah, because I remember you
holders.
Carry some always with the instruments and all that. Into your personal, the PG journey, how was your PG journey here in GDC? Do you have any specific incident you remember that you want to share with us? Or just give us a general idea, how did it go?
My PG journey was poles apart from my UG journey. It was wonderful. I had a great time, because I was finally in the subject that I loved.
Yeah.
So right from the start, it was busy. There was a very heavy OPD, and it was procedures, not just checking and sending the patient, but we were doing 15-20 procedures per day. We were going to casualty and doing soft tissue repairs. We had peripheral postings in all surgical departments of GMC, plus anesthesia and medicine.
Okay.
So that was also very useful, because I got to see inner workings of other surgical branches.
That was for how many months or weeks?
Every department was for 1 week. So we, between ophthalm, ENT, general surgery, neurosurgery, orthopedics, medicine, anesthesia, and plastic surgery. These were the departments that we rotated in.
One week.
One week each.
How would you describe it? Was it like very hectic, or?
For us, less hectic compared to our department, because here we were in an assistive capacity, not handling it on our own. But it was an eye-opener, because we got to see inner workings of other subjects, how an ENT surgeon would approach a similar case differently than that of, for example, cases like space infections in the maxillofacial region. Sometimes they are handled by ENT surgeon. There's an overlap there.
That's true.
And there is a difference of perspective. So that widened our perspective to be rotated in those departments.
Give us an idea what exactly happens in MaxFax. Like, what are the kind of cases you see? How is it different from general dentistry?
Maxillofacial surgery is a whole different world by itself and has its several sub branches. Some of the branches like minor oral surgery and exodontia. Exodontia is dealing with extraction of teeth. Then there is trauma, which forms a large chunk of the cases dealt with in the department here. There are other branches like cleft lip and cleft palate. There is orthognathic and corrective jaw surgeries. There's oral cancer, which is another whole subject by itself. There's oral implantology, aesthetic maxillofacial surgery. And recently there was a controversy about how dentists should not be doing hair transplant. While that may be true, oral and maxillofacial surgeon is trained and capable of handling such cases and is legally allowed to do hair transplant. So that is also becoming a popular branch amongst oral and maxillofacial surgeons now.
Okay, they can do hair transplants and
legally allowed to do.
Okay. You have done 2 peripheral postings also, I think. One in Hyderabad and one in Bangalore. The Mazumdar Hospital, and one was in Reddy Hospital, right?
Yes.
You had postings in, I think, head and neck oncology. That was in Mazumdar Hospital.
Yes.
And then you also had done cleft lip and cleft palate in Reddy Hospital. So how was that experience?
So that was a part of our PG program, where we used to spend 1 month in the cancer hospital. At that point, it was the Mazumdar Shaw Hospital in Bangalore. That was another amazing experience because the HOD of the head and neck oncology department there was Professor and Dr. Moni Abran Koryakos. He's a big name in head and neck oncology. He's written a textbook that is followed worldwide.
Okay.
So to work with him and see him go about treating cancer patients was highly informative and a great learning experience. Patients used to fly from all over the world in that department, and it used to be busy. We used to be on our feet from morning to night, try to grab a little meal here and there whenever you get a chance, operating case after case. We learned a lot of skills which till date I apply in my day-to-day practice.
You always have been a very busy life, sort of.
Yeah, ever since I got into PG, it's been hectic. And
but looking at you, I have never felt that you are you don't like it, or I always seen you in good mood, always ready to work.
Yeah, it's the passion for the subject that keeps me going.
Yeah,
it can get difficult, but if you really love the subject, then you are happy to because or you play that.
Yeah, because I know this because I have got my 2 implants with Dr. Shreyas only, and that is how I understood how much more there is to dentistry, and I thought of having Shreyas on my show at that time only. So finally we have him here. So that I would think is a big success.
I remember Pradeep's case was not difficult. He had very less bone and we had to do a sign lift for you to build it up. Yeah. But you are a very cooperative patient and I'm happy that we could give you a good result now.
I remember that time I had no idea what was going to happen, but you explaining, each and every step and asking me whether I'm comfortable or not, even after giving anesthesia and like all that thing, each and every step Shreyas used to ask me whether I'm comfortable, whether I can feel the pain, and then explaining all the procedures because that becomes very important. Even though I'm doctor, he would have just assumed that I might know some things, but then people don't know that there are a lot of things, and the more you talk to patient, the more they become comfortable. I think that skill is the one that differentiates a good clinician, and I think Shreyas has definitely mastered it. I would say it because I have personally experienced.
Then there was 1 month we spent in Hyderabad in Professor Gosla Srinivas Reddy's hospital. Now that hospital is tied up with Smile Train. So Smile Train is an NGO that deals with treatment of cleft lip and palate cases, and it's funded by them. So for patients it was free of cost. Over that 1 month I was part of hundreds of cases of cleft lip and palate, day in and day out operating, just like Bangalore. A nice break from the routine of GDC, and we got to learn a lot. And Hyderabad and Bangalore as cities have a lot to offer. So we also experienced a lot of that.
Per day, how many cases you used to get?
Hyderabad, their OT list used to be of minimum of 10 patients per day.
Okay. So it's like corrective surgeries and all that.
Corrective like left lip and cleft palate repair surgeries.
Okay.
And they had 2 simultaneous OTs running, so you had to shuffle between the 2 as and when you're scrubbing in.
Okay, but are these postings compulsory or you chose to do it by yourself?
It was a part of the PG curriculum that time. Post-COVID, I think it was stopped for a bit. It was not compulsory. Not every college has it, but we were fortunate enough to have it.
Okay, but it is something which is affiliated with the college itself, or you have to find it yourself?
The college had an affiliation with those institutes, so because of which we were posted.
Okay, handled by college itself.
Yeah,
post you in that.
Handled by the department. It's at department level.
Dr. Shreyas is the first MaxFX surgeon to have done fellowship in TMJ from Goa. I think that's a big feat. How was that experience?
The TMJ or the temporomandibular joint is a subject that has always fascinated me right from the early days of my PG. There are a lot of people now that face issues with their joint. TMJ is very different from the other joints in our body like the knees and the shoulder because this is the only joint that is bilateral. It works with the opposite joint together. The synchronized movements are very important. If there's any disturbance in that, people are going to start facing issues like clicking or pain, deviation, difficulty in opening the mouth. So there are a lot of such issues that people face, and I saw that they are going unaddressed. Somebody needs to study this deeper and solve those problems for people. There is this organization called International TMJ Foundation, and it has faculty that is internationally renowned faculty such as Professor Louis Mercury and Professor Anthony Pogrel. Our Indian mentor is Dr. Darpan Bhargav. He's an oral and maxillofacial surgeon based in Bhopal. Our selection process was quite rigorous. There were applications from all over the world. They shortlisted a few and called them for interview. There were 2 rounds of interview with one-on-one question answer sessions. After that, around 15 people were selected for the 1-year fellowship. It was online. We were attending lectures every week. while documenting cases in our own practice and discussing, there were time to time exams, there were vivas. We had to do a publication as a part of the fellowship. And after everything, the fellowship was granted. At the end of this fellowship, I feel like I'd gotten better at least diagnosing and understanding the issues, because they are quite complex. It's not very simple to understand what's happening, because there are so many things that can cause one particular issue. It's multifactorial. So diagnosis is the first step. Now, dealing with the problems, one does not always have to operate. There are a lot of cases, in fact, a vast majority can be managed non-surgically by maybe creating a few habitual changes in the patient or just addressing their underlying stress. You can give a few appliances like night guards or some biplates to change their vision. And more advanced cases, you can do minimally invasive surgeries like something called arthrocentesis, where you pass 2 needles in the joint and just irrigate a lot of fluid through the joint to wash away the metabolic byproducts that contribute to the inflammatory process. Now, more advanced surgeries like open joint surgery or an arthroscope guided surgery, which require further advanced training. So it is one of my future goals to acquire such training and try to build a team that can handle such procedures in Goa.
That's a very nice goal to have, because something very unique, and I think people definitely need it here. What are the different kind of, you said TMJ, so what are the different kind of conditions that you usually see with TMJ?
The most common condition is called internal derangement. There is a cartilage disc between the bones of the joint, and due to various reasons, it can get displaced. When the disc gets displaced, it breaks the harmony with which the joint moves. It can cause pain, it can cause deviation, it can cause flicking, it can cause difficulty in opening the mouth and difficulty in chewing the food. These issues, if addressed initially, can allow the joint to go back to normal. But if you allow them to just progress, a simple case can become really complicated.
What's the worst thing that can happen?
If the TMJ issue is not addressed initially and it's allowed to progress, it can gradually destroy the joint. The cartilage can get completely worn out and the bones can rub against each other. That causes excruciating pain and hampers day-to-day function. So then that joint may require replacement. In fact, during my time as a senior resident in the department of OMFS in GDC, we had done a few cases like that, and that was, I think, the first protez replacement case that happened in Goa. I was lucky enough to be a part of the team that did that.
That is very nice. A nice feat to have. How do we identify it and then we make sure that we show the dentist on the right time so that it doesn't progress? How does the general public identify whether they have some problem?
Try to notice if when opening your mouth, are you able to open it smoothly, or you feel some clicking happening somewhere, some deflection or deviation happening when you're opening the mouth. Those are early signs. Pain is, of course, one of the later symptoms that presents itself. You have any of those, you can go and visit a specialist and they will guide you on how to go about it. There are appliances that you can wear while sleeping to prevent, clenching. They create a space between your teeth, which directly creates a space in the joint. So that allows the joint to recover better when you're sleeping.
But is it like, does it always progress to that level, or sometimes it is just...
Sometimes it is self-limiting. Like a click without pain is a normal physiological thing to have, which many people have. And it doesn't always progress. But in some cases, it can progress.
So basically, that clicking sound associated with pain can be a diagnostic factor on our level.
Yeah. Okay. And one of the most common cause of TMJ disorders in today's age, we are realizing, is stress. Because of stress, people tend to grind and clench. It's called bruxism, where you subconsciously, even in your sleep, keep on clenching. And because of that, the joint does not get a chance to recover. A lot of metabolic byproducts build up in the joint, and it puts the whole joint in an inflammatory state.
If you have a joint have clicking sound or it is associated with pain, that can be a sign to consult your dentist. What other fellowships are there for?
So there are a few structured fellowships that AOMSI, which is the Association of Oral Maxillofacial Surgeons of India, they offer. They offer fellowships in orthodontic surgery, fellowships in cleft lip and palate, fellowship in oral oncology, and fellowships in trauma. Along with that, there are quite a few aesthetic fellowships for, some things like Botox and fillers or facelifts, rhinoplasties. These are all online. A few of them would be online, few of them would be in modules where you go over the weekend, and then there will be multiple modules.
Okay.
And some of them are full time, where you have to be associated with institution for 1 year to 1.5 years.
You also attended a lot of workshops, and also I think has gone as a speaker. Do you have any specific workshops you remember that has helped you a lot?
Saddest thing I would say is the curriculum of dentistry in India has not really kept up with the international advances that have happened in dentistry. So there is a huge gap between what a real world dentist is doing versus what you are being taught in dental college. Initially, they used to do those silver amalgam restorations. Now that material you will not find in any of the dental clinics. It is important to keep on, upgrading yourself and bridging that gap by doing these courses and workshops. I have personally benefited from a lot of courses in implantology that I've done outside of college. I've done courses in guided bone regeneration. So these are the skills that really come in handy today in my day-to-day practice when I deal with implant cases.
Yeah. And is there, during your course of clinical exposure, is there any case that you felt specifically has shaped your clinical judgment, or you remember it like very clearly?
Yes. So we deal with a lot of space infections, we call it, which is basically infections, head and neck region. As a maxillofacial surgeon, we are always taught to focus on the aesthetics of the face. Don't give a scar, because nobody likes to have a scar on their face. So while dealing with this, sometimes you have to do incisions and drain those infections. And we tend to be a little conservative to try and keep it aesthetic. But we had a case where, it started as a small infection, but it progressed into Ludwig's angina. And I realized that you can't always be aesthetic, because it will not give a sufficient drainage. Sometimes when you have to be aggressive, aesthetics can take a backseat, because you have to look at patient survival rather than just aesthetics.
Yeah. That's a very important point. Finally, the wellness of patient is more than the aesthetic part. So Shreyas also has numerous paper and poster presentations and publications, and I think we would definitely want to know more about that. So Shreyas, can you just tell us more about your publications?
The part of the program was doing research activities, and our professor played a lot of emphasis on that. I was initially never research oriented. I like to focus more on the clinical aspects, but later you realize that it is very important to document what you do and publish it for the benefit of the entire community. One of the interesting articles that we worked on was management of gunshot wound injuries in maxillofacial region. One of the first cases that I had dealt with in casualty as a first year PG student was a gunshot injury, which was somebody was cleaning their gun and they self-inflicted a gunshot injury on their own jaw.
Okay.
The bullet was lodged right next to the nerve inside the jaw.
Okay.
We had to, I remember, call our professor at 6 in the morning, and we did a mandibular swing surgery where we opened this joint, tried to find the bullet. And it was a tiny pellet lodged deep inside.
Okay. So this kind of injuries are very common?
No, they are not really common, but somehow I had a chance of working on 3 of them throughout my career. So I compiled the findings of those 3 and we published it.
Okay, so Shreyas also has his private practice. Now he practices in MAPSA. I'll give address of his clinic in the description. So whoever wants to get the dental checkup done, definitely check it out. Shreyas, in the same line, I wanted to ask, how has been this shift from, shifting from working in hospitals to working in private practice?
So I guess somewhere down the line, I was always meant for private practice, because when I started private practice in 2019 as a visiting consultant to other clinics, I took to it like fish to water. I felt at home right from the first case. And it is very different. There is a financial aspect to this now. That is something that we never learned during our college days, because we don't have to deal with money. Patient comes, gets their treatment done and says thank you and walks out. But here you have to invest in instruments and materials. I use a surgical loops, so that is one of the first things I have to buy. You have to buy a good quality autoclave since you're doing surgeries, and you have to take care of all the sterilization. So there is a certain amount of investment. So then you have to think of, okay, I have to charge my patients now. So that is another aspect, the business angle of it, which you learn slowly as you start private practice.
So how much is the rough range of investment you need to, have if you want to have your own private clinic? Give us an idea, like a rough range of investment, I mean.
I guess it's possible to, if you don't include the cost of the space, it's possible to start a clinic in a budget of around 7 to 10 lakhs, a basic one. But there are clinics which have investments which run in crores, because there are a lot of advancement in dentistry. So it all depends on what all facilities you want to have in your clinic.
Any advice you want to give for people who are looking to start their own practice, or in future they want to start? Because that is one of the main, after PG, main prospect they go into private practice.
The location where you plan to practice, you have to assess the population demographic of that area very well to see how much demand is there for dentistry and whether people are conscious, and make the investment depending on that. Because like I said, there is a business angle to it.
Yeah.
So you can't just throw money and then expect people to walk in.
Yeah.
You have to have your numbers well researched.
Plus, I think it takes time to get into that reputed state where people will come to you and they won't think twice about spending money. I think
initially the people will doubt you. You have to stay consistent, show up, and treat every case with utmost care so that results are good.
Yeah.
And as your results start showing,
more and more people
come, because word of mouth publicity is still till date in this age of social media. Word of mouth publicity is still gold standard in dentistry or any other field of medicine.
Yeah, it works in both ways, positive also, negative also.
So that's why every result matters. Yeah. A good result is the best advertisement that you can have for your practice. Yeah. The biggest turnaround moment came when I got an opportunity to be a part of a team in an existing clinic and handle their surgical cases. Slowly over time, I've added other operatory in that clinic now, where we handle exclusively surgical cases. And when you practice in a team, it just makes everything better, because different perspectives, different expertise, and patient benefits the most from that. Even our major cases now cannot be done in a dental clinic. So for that, I have attachment to hospitals. We take them in the hospital. Patients are admitted and operated under general anesthesia. There also, as and when required, we team up with other oral surgeons.
So that is the important part. Like, don't try to do everything by yourself when you're starting out. If possible, a team would be nice.
Yeah, don't try to be a lone wolf, because the way you can work in a team will always be better than what you can do on your own alone.
Mm-hmm. And there are a lot of other aspects also. Certain people are better at certain things, so they can give their inputs and you learn a lot, you grow over time. Yeah. I think that is how you can gain that confidence in investing more in your setup. And that is the part you want to, I think.
When you have good people in your team, it tends to have a synergistic effect on the overall outcome.
Yeah.
One cannot underrate the importance of teamwork.
Yeah, and starting a private practice is not as easy as it seems. I think there are a lot of factors that influence putting a private clinic. You need to have some level of at least idea or guidance from some experienced person.
Yeah, see, when a patient walks in a clinic, they don't know what specialist they need. They come for a general problem. So if you want to practice exclusively your subject, it's always better to team up with somebody else who will handle the other aspects of dentistry and refer patients to each other instead of trying to do everything on your own.
Yeah, and it's a huge investment.
It's also a big investment.
And I think the first part, what you had said, that you have to know the area in which you are. I think that is going to be one of the most important part. Now, I wanted to ask you about people who are going to choose PG or do PG. As you said, there are a lot of branches. So how does one, go about choosing those branches? It must be a bit confusing to choose. So is there any tip or any guide that might just help them out?
When you choose a branch, I guess your heart has to be in the right place. Don't choose a branch just because, you might assume that there is more money in that subject or something like that. And don't do MDS just for the sake of having MDS. If you want to do MDS, it should be because you love that subject and you want to get into the depth of that subject. Choosing your MDS subject is more permanent than, I would say, getting married.
Yeah.
You can never change your subject there.
You may. Okay, because I have seen a few friends, sometimes they take MDS in certain subject and then they don't feel like it because their heart is not in that field and they want to leave it. So I think, as you said, your heart being in that field is more important than anything else.
I mean, during your internship, you have postings throughout, through all the departments. That is the time to try to figure out what you are enjoying and then pursue PG in that. And it's not necessary that you are, in today's day and age, there are several courses that are in-depth, education in various aspects of dentistry. So it's not compulsory that you have to do PG. You can do good courses and pick up skills which you can then apply in your private practice. So at the end of the day, in dentistry, it is what not your qualifications, but what your hands can do.
Yeah. Private practice, lot of patients who come to dentists have phobia, or they are very scared of the procedures and not cooperative as such. So how do you handle such kind of patients?
Having a good rapport with your patient is the foundation of the doctor-patient relationship. It's important to take time to get to know your patient and for your patient to get to know you. So, yeah. Don't directly put them on a dental chair and start grubbing up.
Yeah.
Let them sit across a table and have a conversation with them, get to know them better, try to understand where the fear and anxiety is stemming from. If you can, get them used to the atmosphere, then slowly, explain what you're going to be doing. A fear comes from the unknown, but when the patients know that what is going to exactly happen and that there is, it's going to be painless, you're going to give anesthesia, most of their anxieties are alleviated at that point. Now there are techniques of sedation and, you can pre-medicate the patients to calm them down. So that also can be utilized to some extent.
Yeah, and I think there are certain cases where sometimes the anesthesia doesn't work, or the anesthesia is not enough and patient starts getting pain. Yeah. I had such experience during my tooth extraction. And the anesthesia actually didn't work on me properly. I don't know why, maybe due to infection or something. It didn't work on me. But then I knew that, me being a medical person, I didn't want to create any scene or something like that. I just told them it's fine. Maybe they must be in training or something, I didn't know. But then it was finished. But I just cooperated but normal patients might not cooperate.
Yeah, so this is my advice to anybody who's training to be a dentist. Please master the art of local anesthesia, because what you do after that, patients will not really care for, provided you are not causing any pain. So give them good anesthesia and then do your procedure.
Yeah. So what are the common mistakes that patients do or general people do that worsen their oral health or dental conditions?
I guess one of the most common mistakes that people do is try to avoid going to the dentist. If only a person visits the dentist regularly, I would say every 6 months to once a year minimum, any caries can be detected at an early stage and can be addressed there. If you delay it, it's just going to progress further, and something that was a simple procedure will end up becoming a complicated procedure later.
Yeah, definitely.
So a lot of patients say dentistry is so expensive and dentists charge a lot. My retort to that is dentistry is not expensive. Negligence on your part is expensive.
Many people, they tend to lose their tooth and they just carry on like that. And many of us don't know that you just can't carry on like that. There are a lot of complications that happen later. So I just want you to, give them some idea that what actually happens. You just leave that, tooth without the implant.
If you, for whatever reason, have to get your tooth extracted, or if you lost a tooth, it's extremely important to replace that missing tooth with an artificial tooth. Now, there are several options of replacing an artificial tooth. Dental implants are the most popular method now. If you don't have a tooth, the alveolar bone of the jaw starts resorbing, and that changes the facial musculature because your face can collapse inside. It will have impact on your speech. It will also have impact on your alignment of your teeth, because the other teeth will try to move into that space. The upper tooth will try to erupt into that space. So it will just change the entire balance of your bite.
Yeah.
This also have long-term repercussions on your joint, something that we were talking about earlier. Always get a missing tooth replaced at the earliest.
I personally myself have faced, and I think my face structure also a bit changed after I got the implant. Before that, as you say, it bits collapses and all that complications happen, and I had to get through a major procedures because I didn't get it checked earlier. So I think if you are someone who's missing any tooth or something like that, so I think you should just definitely take at least opinion of your dentist and move forward according to them. Now, give us some preventive strategies to that our people can follow to prevent any dental health problems.
It starts right from your diet. Try to always stick to a good healthy diet. Don't have a lot of refined sugars and sugary drinks. All those things, they tend to stick around on your teeth and make your teeth prone to developing caries. Then the basic stuff like brush twice a day, morning and night before bedtime. Flossing, because your brush cannot reach between two teeth. So dental floss or using a water flosser really helps. It goes a long way.
So what are the changing trends in the cases you see nowadays in your field?
This is an interesting theory now. It's said that because of these refined diets, our jaws are getting smaller in size because we don't have to do that much chewing anymore, as much as our maybe early humans had to do. So because the jaws are getting small, the wisdom teeth don't have space to erupt and they're getting stuck in different incubation. So nowadays in almost every growing individual, teenagers, so people in their early 20s, wisdom teeth being impacted is very common, and I deal with a lot of such cases where we have to extract them surgically so that they don't cause any further issues. Then there's a lot of technological advancement in dentistry. A lot of materials have changed now. There are better materials available, safer materials. Amalgam, which used to be used earlier, is almost weaned out now due to toxicity of mercury. Impression pastes used to be used to make impressions of the teeth. Now people use intraoral scanners and it is direct digital data sent to the lab. And the models are 3D printed out of that data.
Technology has advanced.
Technology has advanced quite a lot. So one has to keep up to date with all this technology if you want to practice quality dentistry.
We are done with most of the technical part. Now we'll just come to the personal aspect of your life. You said you were playing sports. Even during your UG days, you were into playing cricket. You played for your college. And there has always been that rivalry between GDC and GMC. So how has been your experience? Tell us about some fun parts.
I was always obsessed with cricket. I wanted to become a wicketkeeper batsman. The wicketkeeper part of it never materialized.
No.
But I used to mostly bat at number 3 or number 4 position. It was fun. Rivalry with GMC. They always used to have the better of us in cricket at that time. Until one or two times we got back at that. But yeah, always and good rivalry.
Yeah, that was very good.
The day we used to put our arms around each other and go.
Oh, that's nice. I think it is during that part of time.
Yeah.
Otherwise, it is just all
off the field. We were best of friends.
Yeah. So you still play or
now because of work, I have reduced cricket mostly because I don't want to risk getting injured on my fingers.
Yeah.
Because that will mean I can't do surgical cases anymore. So because of that, I have reduced playing cricket, but I avidly follow all the cricket that is played around the world.
And any other sports, or it was just mostly cricket?
I was also very interested in swimming early on. I used to go for RCC coaching at Kampal, the indoor stadium. But swimming also has now become more of a leisure and fitness activity, and I don't do any competitive swimming anymore.
People might not know that, but you are also a trained guitarist. You also done a lot of shows on stage.
Was in UG in GDC. We had a band that I found with one of my friends in GMC, Dr Swapnil Sarkar. He is now a film writer.
Yeah.
He pursued his fashion.
Yeah.
Our band used to be called Karmic Ritual, and we used to play rock and roll music. We had a few original composition songs that were written by Swapnil. I started off as a bass guitarist in that band, slowly progressed into rhythm and lead. It was fun. We opened for Genesis 1 year.
Yeah.
We did a couple of radio shows and a few other inter-college shows. We knew we would never get too far, but at that point it was a lot of fun. We felt like rock stars.
Yeah, and that point it becomes, it feels very important, close to your heart. Because you can't do that in a later part of your life. That is like...
Guitar is something I picked up quite late in my life. It was something I did in the holidays after my 10th and before joining 11. I did a crash course with one of the music academy in my neighborhood. After that, YouTube is the great teacher.
Yeah.
So I found a lot of videos and taught myself how to play more. Bought an electric guitar and learned how to tinker around on that. And till date, it is one of the activities that's a great stress buster for me. After a tough day, I just like to sit in the corner with the guitar and, tweak on those strings.
So is that the secret behind your marriage? Because girls do tend to like, people who are with the boys who play guitar.
From the experience, I can tell you that time, Karmic Ritual was more surrounded by boys than I was.
That is what happens during UG days. Like you are more in the boys' gang and that ego that no girls allowed and all that. Yeah. You have almost completed 6 years now. So what keeps you motivated to, get up every day, every morning and go to your clinic or go to, see the patients and still see the patient the same enthusiasm till, late evening? Like what is that motivation factor?
Like I said, it's the love for the subject and practice is what helps you improve. So I feel like compared to 2019 to now, I kept on getting better at work every year and I know there's a long way to go. So the will to improve and keep on getting better is what makes me show up in my clinic every day. And also the real life impact that you have on people. People walk into your clinic with a problem and you get to solve those problems.
Yeah.
So it's a position of privilege to, help somebody come out of pain. Now we are in our 30s. Sports person, 30s is when you start retiring. But as a surgeon, this is still the infancy of my career, I would say. Things are just getting started. I just have to keep on focusing on, learning, perfecting what I already know.
I think the main thing which our audience, the young dentists, must be wanting to know from you, give them any tips regarding, joining a PG branch. Any tips or words of wisdom you want to share with them who are looking to choose, PG in the dentistry or who are doing BDS?
BDS can be a very taxing course because it's a lot to balance. There's lectures and there's lab work. There are journals. More than everything, there are expectations. So I would say, instead of letting everything weigh down on you, break it down into smaller parts and focus on the task at hand. Just try to be curious. If you follow your natural curiosity, you'll just end up learning a lot of things. Because practice, keep on practicing, because you might not be able to do it today, but you do it 10 times, 100 times, by 1,000 times, you'll definitely be good at it.
I think we had a very motivational and enlightening session with Dr. Shreyas. I think whatever advice he has given, I think that should help you a lot. Whoever the dentist, young dentists who are looking to do PG in various specializations he had told, and the advice he has given will be definitely very helpful to them. And I thank Dr. Shreyas finally be on my show. I had this in my mind since the time I had met him for my implant procedure. And I'm so glad that we have had this session.
Thank you. The pleasure is all mine.
Thank you, Dr. Shreyas, for being here.
Thank you. Pleasure is all mine.
Okay, I'll see you in the next one. Bye-bye.